Welcome to Premier Plastic Surgery and Aesthetics. So this is our practice dedicated to the aesthetics of the human race. My name is Dr. Juan Brou. I'm a board-certified plastic surgeon with over 30 years of experience here in Oklahoma City. I founded Premier under another name first in 1995. We offer a full gamut of cosmetic procedures, starting with injectables such as Botox or neurotoxins, fillers of a variety. We also have full-service laser services for skin texture, skin improvements, and resurfacing. We do have as well microneedling with radiofrequency for skin tightening. Also, the contouring of the body with cool sculpting. That's among some of our services. We do have more, but I invite you to visit us so you can learn all about our services. A breast augmentation is a procedure that enlarges your breast. So most commonly, we do that with the use of implants, breast implants, which can be silicone, the majority of them, or saline breast implants as well. Some of the augmentations can be done with your own tissue, such as fat. So a fat grafting is an acceptable way to enlarge breasts, although maybe not as dramatically as what you can achieve with a implant. Anybody that has a nice shape and form to their breast and want to enlarge the size, let's say they fit into an A cup size and they want to go to a D cup size, that would be the only way to achieve that would be really with implants. If you were to try to do that with your own fat, you would need quite a bit of fat and more than one episode of surgery to achieve that enlargement. So that's why we resort mostly to silicone breast implants. And the question arises, are silicone breast implants safe implants? And as a matter of fact, they are. In 2006, they were approved for general use by the FDA. And I've been doing a lot of breast augmentation with silicone breast implants, and a great majority of patients are greatly satisfied with that procedure. There's a small number of patients that do have problems with them. Most of them are aesthetic problems. Let's say the breast doesn't look the same after gaining weight, losing weight, or having children, and patient would like to have, in addition to an implant exchange, a lift, something that corrects the shape and form of the breast to match the shape and form of the implant, so you get the best possible aesthetic results. In the year 2006, after 14 years of scrutiny and research, silicone breast implants were brought back to market. And they have been used ever since then. And they're very safe to be used. And but there's a couple of problems that are very concerned about nowadays. And particularly the FDA has required the manufacturers to elaborate a disclaimer that every patient has to read and sign, and I have to co-sign as well. And it's related to two things that are very important. One is the breast implant illness, or breast implant associated illness, which is a disease that is not very qualified or concretely specified, because it presents in different manners, and patients have different symptoms, different constellation of symptoms, and some of those symptoms are fairly vague. For instance, brain fog is one of them, weight loss or weight gain, loss of hair, fatigue is a very common sign. Intense research is being done in the subject to try to qualify or figure out exactly what is going on with those patients. Luckily, they are a very few minority of patients, and some of them have come through my office and I've removed the implants, making those patients feel better. So there is a way to correct this problem, which is to remove the implants. How much needs to be removed, whether there's a need for a capsulectomy or an en-bloc resection, those are things that are still controversial. And I think it's very important for the doctor and patient to figure out exactly what is it that we need to do to improve those symptoms. Majority of these patients have had extensive medical workups with no results at all. So everything seems to be normal, but the patient knows that they don't feel normal anymore. So most of the time, we opt for removing the implants because everything else has been tried. The other issue is the ALCL or BII-ALCL, which is an anaplastic large cell lymphoma. It's a very rare malignancy that presents in some patients that have long-standing breast implants, particularly silicone breast implants and particularly texturized breast implants. So much that Allergan, makers of the natural implants, removed from the market some of those implants that have the texturization that is most aggressive. A lot of people ask me what a breast revision is, and breast revision is nothing more than redoing some surgery. I do that a lot because I do a lot of corrective surgery, but a revision can be anything. It can be just a change of implants, or it can be recutting and redoing the scars, or deeper modifications. So revision just means redoing a surgery that didn't have satisfactory results. Nowadays, I do a lot of corrective breast surgery, which is basically redoing some surgery that was done in the past that either had a bad result or things basically change. People's bodies change a lot in the lapse of 10 or 15 years. I've been in practice nearly 30 years, in private practice. I've been to Oklahoma for more than 30 years. And I have a chance to see some of my patients that I've done 10, 15 years ago and they have changed a lot. And they probably have kids, they breastfed, they gained weight or lost weight or both, and their breasts just don't look the same after that amount of time. So one of the things that I do the most is corrective breast surgery. So those patients go back to surgery. We do generally lifts. We switch the implants, either smaller or larger, whatever the patient wants and is reasonable. And we get very nice results for another 10, 15 more years. So that's one of the most popular procedures I perform nowadays. And if you have any questions about that, feel free to call us so we can arrange for a consultation. Well, the choice of implant size is something very personal. I tend to go with whatever my patients want to do, and so long as it's reasonable, because there are sizes that are a little bit too much for some people, and I will not do anything that I don't think is reasonable. So generally the patient will manifest where are they now, like the cup size they're wearing, and where do they want to be. And sometimes the modification needs to have also a lift or a mastopexy. In this case, we'll restrict it a little bit into how much or how big we can go. Now, if you want to reach a certain size that is a little beyond one surgery, it can be accomplished in 2 surgeries. But nowadays, not very many people want to have more than 1 surgery. So we come to an agreement in which I think that the size the patient is choosing is a reasonable size, and then we can go ahead and proceed with the surgery. Sometimes we're not so sure, so I will have more than 1 set of implants available in case we cannot accomplish the certain size that the patient wants. So I always have to have a backup in case there's not enough room for the desired implant, and therefore we have to go to the next best backup. Okay, the other question I get a lot is how long does it take to recover from surgery? And the answer for that depends on basically what surgery are we doing. So a breast augmentation, a plain breast augmentation is done through a small incision, and the recovery, so long as the implant is not too large, will be of a few days, 4 or 5 days. Most patients that have an office job can go back in 4 days. Patients that have more physical jobs, it's better for them to wait a full week. But then if we need to do a lift or a mastopexy, which is the same thing, there's going to be more incisions and more surgery involved. So therefore, the recovery is going to be a little longer. It could be a week and a half or maybe even 2 weeks. And sometimes we choose to do more than one surgery along with breast. So like, let's say sometimes we do a breast surgery coupled with a tummy tuck. And in that case, the recovery is going to be a little bit more prolonged, like a full 2 weeks or maybe more. So it's good to give yourself enough time to heal, so you would be better off, better results, and you'll have a faster recovery too. A tummy tuck is a procedure that will correct the tummy part when there's some damage that has occurred. And typically the damage happens most commonly with pregnancies and with massive weight loss, or a combination of both. And so what happens is the skin of your tummy is not nice anymore, it's not draping nicely, and it's excessive, and sometimes it's damaged by stretch marks. Most of the damage usually happens in the lower half of the tummy, so the tummy tuck is ideal to correct that. Now, people that have pregnancy sometimes also have damage to their abdominal muscles. So the abdominal muscles separate, and therefore you cannot keep a tight or flat tummy. It just bulges without control. So the tummy tuck is a perfect procedure to correct that, because in addition to remove the extra skin, we also tighten up the abdominal muscles. Some people experience benefits that go beyond the flatness of the tummy, such as they don't lose urine, they develop better competence there, and things like that. So we don't prescribe necessarily the tummy tuck for that, but it's a side effect that is very appreciated. When I do a tummy tuck, we do a consultation. The patient shows me what she wants corrected. Oftentimes, we will not just look at the tummy all the time. We don't just look at the tummy. We look at the body itself all around, so in a 360-degree view. And oftentimes, the changes that led to the tummy needing a tummy tuck, there's always changes that are going to happen in the back side, which can be corrected at the same time, and it complements the result of a tummy tuck. You can really sculpt back a body back to their previous contour before children by doing all these procedures. And typically you're going to hear that one of the most requested procedures is the BBL, or the Brazilian butt lift. So that complements very well a tummy tuck or abdominoplasty, because you're going to remove fat from areas of the tummy and the lower back and the upper back. And you can put all that fat to good use by transplanting it to the buttocks and giving the buttocks an enhancement at the same time. This creates a very nice recontouring of the body that gives the patients confidence and a lot of rewards. So tummy tuck is a rather involved procedure. I mean, a plain tummy tuck may take 3.5 hours. Tummy tuck with liposuction may take more, like 5 hours, sometimes 6 hours, depending on the amount of work to be done. The ideal patient for a tummy tuck is somebody that has a reasonable body weight proportion, that's weight and height proportion, and therefore you can accomplish a significant improvement with a limited amount of intervention. People ask me about the risks of tummy tucks or abdominoplasties. And the truth is that there's probably a long list of possible complications, including vein clots, including infection, including sutures coming off or losing part of the tissues. So those are serious complications, and when they present, need to be managed directly. I am a board-certified plastic surgeon, and I encourage you to get your procedures done by board-certified plastic surgeons because they will care for your recovery. When I take care of a tummy tuck, I take extensive precautions to avoid infections, to avoid blood clots in the veins, and to avoid any kind of tissue loss, which are the main three things that I worry about. So I take extensive care, and my patients cruise very well without any of those complications. And the trick about it is to be expectant. Always be expectant to find one of those complications. So you have to be in close contact with your patient over the phone and have them come for follow-ups and things like that. Always care about the results, the end results. And that's how we avoid trouble. The recovery of a tummy tuck is a little bit longer than breast surgery. It usually takes a full 2 weeks and sometimes a little bit more. And the reason for it is that the tummy is a central organ of the body, and therefore moving is difficult at first because there's a lot of tightening and a lot of contouring that happens during the surgery. So people tend to take a little bit longer. It's advisable to have a recliner where to recover because it's going to be hard to get in and out of bed at first. It's also advisable to get a walker for the first few days, but you should be able to walk straight within the end of the first week. The second week is better. Most people stop taking pain medication then. And at the end of the second week, most people start feeling more normal. They're really getting ready to get out of the house and do more normal activities. Now, in order to hit the gym, I would advise to wait more like 4 weeks. And you must start with the lowest possible weights. And any exercise that hurts should be postponed for a week or two. But recovery will ensue, and you're going to feel well and you're going to be ready for this coming summer and bikini season. Blepharoplasty is the scientific name for the eyelid tuck. So when we start aging, one of the first places where we show the aging process is in the eyelids, upper and lower eyelids. Most commonly, we start with excess of skin in the upper eyelids, and then to follow, we'll develop that bags under the eyelids. Too much work, too little sleep, too many worries. That all reflects in your face. So when people start showing these signs of aging, they look tired, and they're tired of being asked, why are you tired? Why are you mad? When they're not. So The blepharoplasty corrects statics of the skin, opens up your eyes, gives you a more alert look. It's something that it's okay to do at an early age. Most of the time, people that manifest this is because there's a family trait. It's something that happens in families. They remember that their father had their eyes done, their grandpa had their eyes nearly closed with excess of skin, and things like that. So typically, it's a family trait, and it appears early in life, in your late 30s, 40s, and so on. Luckily, it's a pretty simple operation, and it renders very nice results. And it changes completely the attitude of the patient and the competence of the patient. So the patient feels much more confident and show up their face. And especially for women that apply makeup, they're able to put the makeup on and enhance their eye look tremendously. Eyelid surgery is very popular and it's very rewarding, especially for people that develop early on these signs of aging. So, for instance, the upper eyelids are very easy to correct, and sometimes we do that here in the office under local anesthesia. Sometimes we use the nitrous oxide inhalation. Sometimes we use medication like a Valium and a Percocet. And it's very easy to recover from. And I use absorbable sutures so we don't have to remove them. They're not going to feel sick and they don't have to be in bed or anything like that. You can go on with your normal life, but it's not going to look pretty for about a week or two. So you want to stay home, relax, and as things heal, and then you're going to start looking good at about a month later. The lower eyelids are a little bit more involved, so I use a regular operating room to deal with them, and they're a little bit more involved in terms of how much you can remove and things like that. People ask me a lot about fat grafting. And the truth is that when I was doing my residency in 1904, we used to not think much about fat grafting. As a matter of fact, it was something that was considered temporary and just a filler that would go away eventually. But it was thanks to Dr. Sidney Coleman in New York that we all learned how to do fat grafting the right way. And it's an incredible operation that helps out in many, many ways. Fat grafting can help out with scars. It can help out with aesthetic procedures. For instance, very commonly when I do a facelift, I will use fat grafting to enhance the volume. Because with aging, we lose a lot of volume, and that's what makes the skin sag. So when you tighten the skin, put it back where it should be, then you still have that loss of volume on the face. And fat grafting is the ideal way to restore that lost volume. And it's amazing the amount of rejuvenation that you get by restoring volume with fat. Fat also, as a cellular graft, has the ability to induce improvements in the quality of the skin. That's why it's used very commonly in reconstruction. Well, the fat grafting surgery is something that is done generally with another surgery. For instance, you're doing a tummy tuck and you want to enhance the buttocks, so you take the fat from the tummy, put it in the buttocks. So that's one surgery. Now, sometimes we're going to restore breast volume and there's no really good donor sides. So we sometimes look at the arms, and sometimes the arms are a good source of fat. The trick is that fat has to be harvested in a certain way and has to be re-injected in another specific way to ensure the maximum take of the graft or function of the graft. Fat usually takes in about 60 to 70%, sometimes more, sometimes less. And that's what you should expect for a result. Now, how long does it take to recover from that? It depends on the associated treatment that you're doing at the same time. For instance, the other day, yes, I had a patient of mine who I had removed her implants and did some fat grafting, but she wanted more. And in cases like that, you have to see whether the patient has good sources of fat, because you don't want to over resect or take too much fat from the donor side and cause a problem in another place to fix this place. That's not good. That's not good medicine. So you have to always be very selective of your donor sides so you don't cause any additional problems. Risks from fat grafting. Yes, there's definitely risk associated to fat grafting when it's done improperly. And this is something that has transpired in the past in other countries and also in our country, particularly in the area of Florida, where fat grafting has been done not following the correct procedure that needs to be done. And fat can be very dangerous when injected into the circulatory system, particularly into the veins, and it goes to the lungs and produces thrombus there, or fat emboli, which is could and can be a deadly problem. Now, the ASPS, the American Society of Plastic Surgery, had appointed an ad hoc committee to study these problems of fat grafting to the buttocks that migrate to the circulatory system. And they've concluded that injecting fat into the buttock muscles is very dangerous because it can easily break the veins in between the muscles and migrate into the circulatory system or bloodstream. So there are some recommended ways of doing the fat grafting, and one is to use a large cannula and use vibration and inject it only in the subcutaneous tissue. Never try to inject into the muscles. And we've seen that allows for a safety use of fat grafting. Oftentimes I hear my patients, when I tell them, okay, you're a very good candidate for fat grafting, they go, but isn't that dangerous, doctor? And the answer is yes, it can be very dangerous when done improperly in untrained hands. I have never had a patient that developed such a complication as intravascular injection of fat. And I've used a lot of fat grafting in the face, in the breast, and in the buttock areas. One of the very important applications of fat grafting is for breast reconstruction after cancer, because a lot of the patients that have breast cancer receive radiation to the breast, and that changes the tissues permanently. So the skin becomes very hard and pale, and it looks burned. Now with fat grafting, you can manage to change the biology of the skin in a reconstructed area and make it soft again so it looks and feels like a normal breast. It's amazing what it can do. Now for cosmetic uses, I use it a lot in the face, as I said, in order to restore volume. You can use it in hands to cover those tendon and veiny looking hands of old people. And another place I use it is for breast corrections. I don't do reconstructions in general. I do a lot of cosmetic breast surgery. And sometimes we have adverse results. Sometimes we have asymmetries to correct. And sometimes we want to get rid of old implants and restore some of the volume loss from that. For all those reasons, I love to use fat grafting because it's your own tissue, it's live tissue, and when it takes in place, it functions as a rejuvenating agent. One of the very important uses of fat is in body contouring, especially people that have tummy tucks done at the same time.
You can use all that fat harvested from the abdomen and from the upper and lower back and use it to enhance the contour of buttocks. So buttock enhancements are done with fat grafting in a very satisfactory way. So fat grafting to me is almost miraculous, all the things you can do with it. Facelifts are very nice procedures that enhance the beauty of a patient tremendously. Typically in the late 40s and early 50s is when patients start noticing that sagging of the skin, particularly in the jawline, the formation of jowls, and with excess of skin and sometimes fat in the neck area. All of that coupled with a loss of volume on the cheek area that makes that skin sag even more. And the facelift addresses all that. So the facelift addresses the lower 2/3 of the face, and from the upper third, we consider that a brow lift, which some people consider as a part of a facelift, but in reality is a different operation. So when a patient is in the right height to weight proportion, and it's nice and active and athletic and things like that, that makes the ideal patient for rejuvenation. So restoring the anatomy in this part of the face, which includes the jawline, the jowls, and the excess of skin in the neck, has a tremendous impact on the way people judge their age. So it's amazing, but you subconsciously are kind of assessing people's ages by the way they look in this area. And you can see that with photographic evidence of patients before and after facelifts that show the dramatic improvement when you modify that area. Facelift is a pretty long operation. It takes me about 5 hours to do. And the care is done on an outpatient basis. We use a compression dressing at the end of the procedure, and the patient is seen in the office the next day to tell them how to do the care of the incisions and things like that. The recovery takes about a week and a half to 2 weeks to feel normal, but socially you're not going to be presentable for a good 3 to 4 weeks. So you have to take into account that, and if you have any big events, you don't want to do a facelift too close to that event. You give yourself a month or so or more, because more is better.
Today we're going to talk about hormone replacement therapy. This is a treatment used to restore hormonal balance. We do this by supplementing hormones such as testosterone, estrogen, and progesterone. This therapy is commonly used to alleviate symptoms caused by hormone imbalances such as those related to menopause, low testosterone levels, or certain medical conditions. The goal is to provide relief of symptoms such as mood swings, low libido, fatigue, and more. We do this by utilizing bioidentical hormone pellets as well as other supplementation. Restoring hormonal equilibrium can also have long-term benefits for overall health, such as reducing the risk of osteoporosis and heart disease. Hormone pellets are about the size of a grain of rice, and they are inserted by using a small incision, and they are placed with minimal pain and downtime. Pellet placement for women can last approximately 4 months, and for men approximately 6 months. Each individual's needs and response to treatment may vary, so personalized care is crucial in achieving the best possible results for overall well-being.
A very important complement to rejuvenation is to maintain a healthy body and a healthy mind. And for that, we decided to include into our practice wellness and hormonal replacement. So BioT is a company dedicated to the correction of hormonal imbalances in people that start feeling the changes of life. So what is the BioT method? The biopsy method deals with the main functional hormones, which are testosterone, estrogen, and thyroid hormones. And it has all to do with the replacement of these hormones once they're found to be absent or in decline. So the way we do this is by doing a patient interview and having them fill out a questionnaire that asks key questions about typical symptoms that you may have. That, along with doing some lab work to see what the status of your hormones is at the time, can be tailored into a treatment, which is administered via pellets. And pellets are compressed forms of hormones that release slowly in the body, so you'll achieve a normal physiologic level of hormones and correct all these deficiencies.
I would say probably by the third or fourth day, I noticed an uptick in my energy level. I noticed that I could feel a difference. It wasn't something that I went into expecting a difference immediately, because I didn't want that expectation to cloud what I thought may be there or wasn't. And I noticed definitely a change within the first 3 or 4 days. Everything was explained ahead of time, and everything that they were going to do, they told me step by step what was going to happen, and let me ask as many questions as I needed to before we even got into the room to do anything. And everything went exactly the way that it was explained. It was pretty simple. It was no pain. It was, exactly like they explained. You would feel just a little bit of pressure, and everything was over, pretty quick.
Today we're going to talk about our medical weight loss program. Our medical weight loss program offers a comprehensive approach to help each individual achieve their weight loss goals. We provide you with a personalized plan, GLP-1 injectable medications, as well as dietary and lifestyle guidance. Our team works closely with each patient to provide ongoing support. We do this while ensuring an approach to weight loss that is sustainable.
Hello and welcome to my Cool Sculpting studio. Today we're going to talk about this equipment, the Cool Sculpting, what it is, and the new edition of the Cool Sculpting Elite, which I'm here very proud to present to you. Cool Sculpting is a non-invasive treatment for excessive fat or unwanted fat. What it does is it can contour some of the extra fat you may find in your body without the need of surgery, which is amazing. And it works by a process called the cryolipolysis or cryolipolysis. What it essentially means is, with the use of cold temperature, we can dissolve or neutralize some fat and therefore contour some areas of unwanted fat. Broadly, is anybody that has an isolated area of excess of fat that can be pinched, can be grabbed, and because sometimes you have folds that are pure skin, and that wouldn't respond very well. So it treats mostly the underlying fat that you can pinch in certain areas where you can attach an applicator and treat it. On the flip side, who is not a good candidate for cool sculpting, and that would be somebody with overall excess of fat and obesity that cannot be treated adequately, and people that have a lot of redundant skin, like for instance after massive weight loss. So when the problem is the skin, obviously it's not going to be corrected with cool sculpting. Basically, the applicator will chill the area of fat to a certain temperature, and the temperature is somewhere between where the fat congeals and when the water congeals or becomes solid. So if you can keep it within that margin of temperature, the fat cells are very sensitive to the fat inside them to congeal, so they burst and disappear. In average, they say that cool sculpting will eliminate 25% of your fat cells in a certain area, which is what makes a difference in terms of contour. So what I'm showing you here is an applicator. So this is the piece, and there's several different applicators for different places in your body. And what I want to show you is that this cavity is where the fatty tissue is going to be fitted into, and this is where the chilling will occur. And you're connected to this for about 45 minutes or sometimes less with the new technology. And then after it's disconnected, you need to have an intense massage in the area, which could be quite uncomfortable, but it's not necessarily painful. It's just that we need to restore the circulation in the area so the process will continue favorably. Every fat cell that bursts because their fat is congealed will go away forever. We do have a limited number of fat cells in our body, and unless you increase your weight significantly, the number of fat cells stays about the same. Once the fat cells are eliminated with the process of school sculpting, they will never come back. However, that doesn't keep people from being able to gain weight and enlarge that area again with the current fat cells in place. So it requires that the patient that has the cool sculpting maintains a reasonable amount of weight over time, so the results will stay in place. The truth is that school sculpting is not a weight reduction process or treatment. So the amount of fat that is eliminated, like I said before, is about 25% of fat cells. That probably wouldn't have much of an impact on the scale. So cool sculpting is just a contouring process. It's not a weight reduction process. The cool sculpting takes approximately 45 minutes per application. So you should consider spending a good 2 hours in the process of getting ready, getting connected, doing the process of school sculpting, the massage that follows that is essential for good results, and then the time that you can go back home. The downtime is nothing. I have done this procedure several times, and you feel discomfort and you feel the area probably swollen for about a week, or sometimes more, sometimes less. And then after that, you don't notice anything until you start noticing the results. That happen in about 4 weeks or so. You notice the area starts becoming smaller and thinner, and that's when you get excited about it. Cool sculpting is a very benign procedure. It really doesn't lead to any serious complications or problems, but sometimes there's some side effects, and mostly has to do with the application process and the area where it has been applied, which can experience some swelling and also tenderness for about a week or so. People generally ask me, when is the right time to do cool sculpting when you have plans for vacations or summertime and things like that? And the answer for that is that cool sculpting is done in sessions, and we generally advise you to do at least 2 sessions to see a result that is acceptable. Sometimes we need more sessions, and we separate those sessions about 6 weeks apart. So you need to consider, start your process probably 2 to 3 months before the summertime or any planned vacation. Well, today I want to introduce to you Brou, who is our technology expert in cool sculpting. She has been trained in the traditional cool sculpting as well as in the new elite cool sculpting. She has attended a cool sculpting university and is geared to get her master's in that training. She is here to help you decide and treat the areas that are of concern.
I am excited for this new technology and to map you out a personalized plan for your new cool sculpting journey.
The Cool Sculpting treatment is an innovative, non-surgical way to contour your body by safely and effectively freezing stubborn fat away. Many of us have stubborn fat despite diet and exercise. Cool Sculpting effectively targets fat cells underneath the skin without damage to the skin or surrounding tissues. Treated fat cells are frozen and then die. In the weeks that follow, the body naturally processes and eliminates these dead fat cells. Treated fat cells are gone for good. Results may be seen as early as 1 to 3 months after treatment.
Hello, I'm Dr. Juan Brou. I'm a board-certified plastic surgeon and the owner of Premier OKC, our medical spa. And today I wanted to talk to you about the excitement we're experiencing with our new Cyton technology. So we have acquired a laser that is a double laser for resurfacing. We have acquired the BBL, which is a light pump that treats pigmentation, redness, and texture problems. The BBL is what is called a broadband light, which is treatments with a light source that pumps light. It's not a laser, but it's a pump of light. And you can design the kind of treatment you want to do to treat either texture, vascularity, blood vessels, or redness in general, and also pigmentation. And then you proceed with what is called the halo. The halo is a double laser technology that does ablative and non-ablative treatments. I know everybody's like, what is that? Well, basically, what the laser does is it kind of drills little holes in your skin and allows your skin to heal from within. And that improves the texture of your skin, reduces wrinkles, and just improves the health of your skin. I'm really excited. This treatment is really remarkable. It's very effective, very quick, and non-painful. And it's a significant upgrade from our previous technology, which is very satisfying.
Hi, I'm Danielle. I'm a nurse practitioner here at Premier, and today I'm going to talk about Cyton's Halo laser. Halo is Cyton's first hybrid fractional laser that can be used on all skin types. Halo combines ablative and non-ablative wavelengths to offer amazing results with minimal downtime, lasting approximately 5 to 7 days. The ablative lasers work by removing the top layer of the skin, while non-ablative lasers work by heating up the underlying skin tissue while not harming the surface. With the Halo treatment, you will see a dramatic reduction in sunspots, fine lines, wrinkles, skin dullness, and more. It is a complete skin revitalization treatment. It works by triggering your body's natural healing response while revealing that luminous glow that you had at a younger age. With Halo, you will accomplish ablative results with non-ablative downtime.
Hi, my name is Maddie, and I'm a nurse injector here at Premier OKC. I'm here today to talk to you about one of my favorite treatments, BBL, or broadband light therapy. BBL is one of the most sought-after devices for people looking to treat sunspots, age spots, rosacea, acne, visible vessels, and so much more. Here at Premier, we use Cyton BBL Hero, which is BBL High Energy Rapid Output. This non-invasive treatment uses powerful broadband light to gently heat the skin's surface and intentionally trigger your body's natural healing ability. In turn, your body will produce more natural collagen and elastin, helping firm the skin and decrease the appearance of wrinkles. During a 10-year clinical trial, BBL was and is still proven to be an anti-aging device by actually changing the gene expression of the skin cells. It is recommended to receive 3 or 4 treatments, plus maintenance treatments to keep the skin healthy. BBL Hero, in combo with all of the services here offered at Premier, will enhance your aesthetic treatments and, therefore, your results. Your aesthetic services shine when you have healthy skin. Ask us about our BBL Hero packages today. Today I'm going to talk to you a little bit about Moxie by Cyton. This laser is a non-ablative laser that targets uneven skin tone, texture, pigmentation, and fine lines and wrinkles by stimulating collagen and elastin through heated channels in the skin. Moxie is perfect for anyone looking to target sun damage on their skin, melasma, or even just a little prejuvenation for the skin. With Moxie being non-ablative, that means your downtime for this procedure is very minimal. You're looking at maybe 2 to 3 days of social downtime, and then 5 to 7 days of freckling or peppered appearance to your skin. For optimal results, we recommend 3 Moxie treatments for a corrective series, and then we enter a maintenance phase of 1 to 2 treatments, or however many treatments you feel like you need throughout the year to help correct your melasma, pigmentation, or just give your skin that nice glow. We are now offering topical exosomes at Premier. These are tiny, naturally occurring vesicles, messenger cells, that are packed with growth factors, proteins, all the good stuff that our skin needs to heal, and these exosomes go to our damaged cells and revive them and help reduce inflammation, pigmentation, and even help stimulate collagen and elastin over time. Topical exosomes can be paired with almost any in-office treatment and can even be taken home with you for your daily skincare routine.
Hi, I'm Danielle and I'm a nurse practitioner here at Premier, and today I'm going to talk to you about Botox Cosmetic. Botox is a neuromodulator that works by temporarily blocking nerve signals to muscles, causing them to relax. Botox Cosmetic is approved for over 30 therapeutic and aesthetic uses worldwide. This would include the moderate to severe frown lines between the eyebrows, crow's feet, and forehead lines. These are common areas where wrinkles and fine lines tend to develop due to repetitive facial movements, expressions, and aging. One of the remarkable aspects of Botox Cosmetic is its relatively quick onset of action. While individual results may vary, many patients may begin to see improvements within 1 to 2 days after treatment, with the full effect typically becoming apparent within 1 month. The duration of Botox Cosmetic's effects is generally around 4 months, although this can vary from person to person. Regular maintenance treatments are often recommended to sustain the desired results over time.
I'm here today to talk to you about Dysport, a neuromodulator by Galderma, FDA approved since 2009. Another alternative to Botox, it is still compromised of botulinum toxin type A and protein bound. It typically does have a quicker onset than Botox, usually anywhere from 24 to 48 hours. It is comprised of a small molecule, so it tends to have a wider spread and even distribution. It is important to note that since this toxin spreads more easily, we use caution around areas where widespread isn't wanted. Dysport is only recommended for use in the upper face muscles, the glabella, the forehead, and the crow's feet. With proper dosing, this medication can last anywhere from 3 to 6 months. Results may vary for each client depending on how well they follow post-treatment instructions and their lifestyle. I'm here today to talk to you about Daxxify by Revance Aesthetics, the newest neurotoxin on the market. This neurotoxin is peptide-driven and with proper dosing can last you up to 4 to 5 months duration. This is due to the advanced peptide technology. Peptides help the toxin complex attach to the cell membrane more efficiently and helps the neurotoxin complex stay attached to the cell. It is believed that over time, this extended period of attachment may help your cells internalize more of the core neurotoxin. And as a result, you may have longer lasting results. If you are someone who lives an especially active lifestyle, this neurotoxin may be perfect for you. Because when we work out, proteins are burned through more easily. Daxxify uses peptides instead of proteins, therefore, we may have longer results. Pair this with medical grade skincare and you can say hello to absolutely glowing skin.
Looking for a non-surgical way to restore volume, smooth wrinkles, and enhance facial features? Injectable fillers might be the perfect solution. These gel-like substances, typically made of hyaluronic acid, are carefully injected beneath the skin to add volume and reduce signs of aging. Fillers can plump lips, restore lost volume in cheeks, soften smile lines, and even contour the jawline, providing natural-looking results with minimal downtime. The procedure is quick, typically taking under 30 minutes, and results can last anywhere from 6 months to 2 years, depending on the type of filler used. Premier offers a variety of dermal fillers, and our providers will help you determine which one is best for you based on your specific needs. Whether you're looking for subtle rejuvenation or more defined facial contours, fillers offer a safe, effective, and customizable way to enhance your natural beauty. Want to restore youthful volume and improve skin texture naturally? Sculptra might be the perfect solution. Unlike traditional fillers, Sculptra is a biostimulatory injectable made of poly-L-lactic acid. It works by stimulating your body's natural collagen production, gradually restoring lost volume and improving skin elasticity over time. Sculptra is ideal for treating hollow areas, softening deep wrinkles, and enhancing facial contours with results that appear gradually and can last up to 2 years or more. The treatment is minimally invasive with little downtime, making it a great option for those seeking long-lasting, natural-looking rejuvenation. For a refreshed, youthful look that builds over time, Sculptra is a powerful collagen-boosting solution. Book a consultation with one of our providers at Premier to determine if Sculptra is right for you.
Hi, my name is Danielle, and I'm a nurse practitioner here at Premier OKC. And today we're going to talk about PRP, also known as platelet-rich plasma. PRP is a topical or injectable treatment that uses a person's own blood. Once your blood is drawn, it goes through a special spinning and separation process in order to separate out the platelet-rich plasma. Growth factors are released from the plasma, which in turn amplifies the healing process when used as new collagen begins to develop. This has been shown to provide an overall rejuvenating effect on the skin's appearance. It's great for improving skin texture, fine lines and wrinkles, and increasing volume and more. It can be used alone or in conjunction with many other treatments.
Are you hoping for more radiant skin with a lasting glow? SkinVive by Juvederm is the first and only hyaluronic acid microdroplet injectable designed to improve skin hydration, texture, and elasticity. Unlike traditional fillers, SkinVive enhances your skin's overall quality rather than adding volume. This innovative treatment boosts hydration from within, reducing fine lines and giving your skin a refreshed, dewy appearance. The procedure is quick with little to no downtime, and results can last up to 6 months, perfect for those wanting a natural, healthy glow. SkinVive is ideal for all skin types and works beautifully alongside other aesthetic treatments. For radiant, hydrated skin that lasts, SkinVive is the ultimate skin-boosting solution. Book an appointment with one of our providers at Premier to refresh your look with SkinVive.
Hi, I'm Maddie, nurse injector here at Premier OKC, and I'm going to talk to you about chemical peels today. Here at Premier, we offer different types of chemical peels to address different skincare concerns, whether that be hyperpigmentation, melasma, fine lines, and wrinkles. We have you covered with all of the chemical peels we offer here. Chemical peels work in a variety of different ways depending on their strength. Our lunchtime peel or our stimulator peel by ZO is a very mild peel. It targets the top layer of our epidermis to take away extra layers of dead skin cells. Mild chemical peels are really great for anybody who is looking to just brighten up their skin. If they're struggling with dullness of the skin, these are a really great peel option. Deeper peels, they are intense and they do require a lot of pre and post treatment, but they are so beneficial. They stimulate new skin cell turnover. They really address collagen and elastin stimulation. These will help with fine lines and wrinkles, even texture and tone problems as well, because we are getting deeper into the layers of our skin and turning over that fresh new baby skin. Today I'm going to talk to you about Skin Pen microneedling. Skin Pen is an FDA approved microneedling device that makes micro injuries into the skin at a tailored depth to target acne scarring, hyperpigmentation, dullness, skin laxity, or combat fine lines and wrinkles. The downtime with Skin Pen is very minimal, maybe 1 day of downtime with some true redness on your face, but the next morning you're usually good to go about your regular normal routine. Optimal results with Skin Pen can be seen in 4 to 6 months. This is usually when we see optimal collagen and elastin production out of the micro injuries created in the skin. Hi, I'm Maddie, nurse injector here at Premier OKC. I'm here to talk to you today about a consultation for skin health. Healthy skin is firm, it is taut, it is hydrated, normal in color, even in tone, and it is tolerant and free from disease, such as rosacea or acne. When our goal is healthy skin, we must commit to our skin because it's a journey. First, in our skin health consultation, we will discuss what your skincare goals are. If you have problems with hyperpigmentation, acne, or just dullness of your skin, these are all things we can address here at Premier OKC. Whether you're looking to maintain the skin you have right now or totally restore your skin health, we have protocols here at Premier OKC to address your specific needs. In addition to your take-home skincare, we have several modalities here at Premier OKC that can help achieve your healthiest skin, such as broadband light, lasers, or other minimally invasive treatments such as Diamond Glow. Here at Premier, we're with you every step of the way through your skincare journey. Book your skincare consult today to achieve your healthiest skin.
Are you looking for a powerful, non-surgical way to tighten skin, reduce wrinkles, and improve texture? Vivace RF microneedling combines the benefits of microneedling with radio frequency energy to stimulate collagen production and rejuvenate your skin from within. This advanced treatment creates tiny micro-injuries while delivering heat deep into the skin, triggering natural healing and boosting collagen and elastin. The result? Firmer, smoother, and more youthful-looking skin with minimal downtime. Vivace is ideal for fine lines, acne scars, enlarged pores, and overall skin tightening, delivering noticeable results with little discomfort. If you're ready for a glowing, lifted, and more youthful complexion, book a Vivace RF microneedling consultation today. Our providers here at Premier are ready to help you turn back time.
Hi, I'm Maddie, nurse injector here at Premier OKC, and today I'm going to talk to you about dermaplaning. Dermaplaning is a really quick and simple treatment that can be added on to pretty much any service offered here at Premier OKC. This treatment uses a medical-grade surgical scalpel to gently remove excess dead skin cells from the top layer of your skin. The benefits of this treatment are it can help your skincare products penetrate your skin better, getting those dead skin cells away. It is quick, simple, and it adds an extra glow to any service we offer here. Hi everyone, I'm Maddie, nurse injector here at Premier, and today I'm going to talk to you about the Diamond Glow Facial. Diamond Glow Facials are non-invasive medical grade facials that use a diamond grit bit that helps extract, exfoliate, and infuse a customized serum based on your skin's needs. Diamond Glow Facial targets common skin concerns such as hyperpigmentation, fine lines and wrinkles, clogged pores, acne, and dull, lackluster skin. This procedure isn't painful. It's a quick 30-45 minute procedure, and you can expect almost immediate improvement in your skin's appearance, such as glowing, soft, supple skin.